Good morning. My name is Dr. Kathleen Christians. I'm a professor of surgery at the Medical College of Wisconsin in Milwaukee in the Division of Surgical Oncology. My specialty is HPB surgery, which is a fancy terminology for liver, pancreas, and bile duct surgery. Today's episode of the Pancreas School is all about robotic surgery. So why minimally invasive surgery? Well, it's important to realize that here at the Medical College, we try to match the patient's tumor or disease process with the appropriate modality for surgery. So if patients have large tumors that are involving major vasculature or blood vessels to important organs, then they may be more appropriate for an open surgery. Other tumors, however, may be more appropriate for laparoscopic or robotic surgery. Now, what's the advantages of robotic surgery? Well, from the patient perspective, you have smaller incisions, less pain, faster return to activities that you love to do and or work, and it's a better cosmetic result with less risk for hernias. From a surgeon's perspective, I get to see in 3 dimensions. I have wristed motion, meaning anything that my wrist can do as opposed to chopsticks from laparoscopic surgery. And it allows me to have more maneuverability, and especially in small spaces, it's much easier to get to with the robot than in open surgery. Let me take you on a tour of our operating room where I will be doing a robotic case today. Now, we're inside the operating room, and what the patient will first notice as you walk in, there are several people that you will see as you come in. We have our anesthesiologists, we have our nurses, we have our surgical techs, and we have people helping us do the case itself. Now, if you come closer, I can show you what the robot looks like. So this is the actual robot, and if you've looked real closely, you can see these are the arms that we move, that we are controlling as a surgeon. And the patients themselves will be on the operating room table. They have special padding. They have goggles that go over the eyes to protect your eyes. They are on this well-padded surgical bed to keep them from moving and safe and sound during surgery, and their arms are wrapped in deep padding. And then if you come this way, all of our surgical instruments are being set up here on these tables over here. And one of our wonderful surgical techs here is helping set up the operating room. So this is an example of one of the ports that we access the abdomen in. So we get into the patient, place the port in their abdomen, and put gas through this area. And that helps give us an expanded abdomen so we have space to work. And then our robot instruments look like this. You can see they're on these very long cannulas, but again, they go through these small tubes so we can keep our instruments very small, our incisions very small. So this is what is getting handed back and forth and through the ports during the case. Now, as you come this way, this is what the surgeon, or in this case myself, is controlling, which is the console. And we are seated here very close to the actual patient and operating room table, not out of the room as some people think. And what I'm doing here, this is set up for my specific specifications. My head goes in. I'm watching what's going on in the abdomen. And if you focus here, my fingers in these little loops are actually controlling those instruments that our surgical tech just showed. So this is the basic setup of robotic surgery. Now, as I indicated in the earlier part of this episode, not all surgeries are appropriate for robotic surgery, and that's where your surgeon comes in to help you guide you through this process. In pancreas tumors in particular, the ideal candidates are most neuroendocrine tumors in the pancreas, often cystic lesions of the pancreas, and some metastatic lesions such as renal cell are ideal candidates for robotic surgery. I also do major vascular resection reconstruction surgeries for locally advanced and borderline resectable tumors, just like Dr. Evans. And coming soon to the Pancreas School, we will soon be showing you some videos of these cases so you can see for yourselves what we are capable of doing here. Thanks again. I'm Dr. Kathleen Christians from the Medical College of Wisconsin.